Nearly 2 million cases of breast cancer are diagnosed around the world every year. It's a disease that can impact anyone, including one East Texas doctor who not only treats breast cancer patients, but whose wife is a survivor of breast cancer. Our Alex Ositis has his story.
It changes the whole dynamic of what's going on in the family. When somebody as beloved as the mother and the wife is now suddenly thrust into the role of the patient.
And Dr. Michael Klouda knows all about how breast cancer can change a family. His wife was diagnosed 2 years ago. She's since beat breast cancer, but the experience for her husband is one that'll live on. Klouda says having been through the conversations on a personal level, he says relating to his patients starting their battle with breast cancer comes with a little more empathy.
There are times where I'm discussing things with one of my patients and I'll say, look, when my wife was contemplating surgery, or when my wife went through chemo, we found such and such.
Klouda, who's worked at ETMC's breast center for over 14 years, says women need to be on alert for lumps. As in the case of many, some that can be felt may not otherwise be detected.
The lump itself would not have been found on the mammogram, and that doesn't mean mammography is useless. It just means that not all breast cancers can be detected on a mammogram.
However, Klouda says the advances in breast cancer treatments and detection allow for a more accurate diagnosis.
We're really in a golden age of imaging where we're finding things smaller and more significant. And the big upside to all this is that women that are truly okay, we're able to tell them you're fine, and we're reducing our number of callbacks.
For Good Morning East Texas, I'm Alex Ositis.
Dr. Klouda says DNA sequencing of tumors is another method being used to tailor a treatment that fits the cancer, something he says wouldn't have been done for breast cancer patients 20 years ago.